The following materials will need to be prepared prior to beginning the procedure: a clean set of clippers, isopropyl alcohol, cotton balls or 4x4 gauze, a 3 or 6 cc syringe and needle, 22 or 25 gauge needle, appropriate test tubes. We will begin with a step-by-step overview of blood collection from the femoral vein. Begin by washing your hands and have the handler place the patient on the exam table. For a femoral vein blood collection, have your assistant stand on the opposite side of the extremity being used and place the patient in lateral recumbency. Shave the hair over the vessel and use isopropyl alcohol on the skin over the femoral vein. Next, have the assistant use their other hand to reach over the hips and place their hand under the top rear leg to expose the inguinal area of the bottom rear leg as seen here. While the assistant is holding the rear leg up, they should press down on the bottom leg in the inguinal area to serve as a tourniquet to the femoral vein. A commercial tourniquet is more difficult to place when collecting from the femoral vein and is normally not used. Prior to venipuncture, break the suction seal created between the syringe hub and plunger by gently pulling back on the plunger, then replacing the plunger to its original position. Insert a 1 or 3 cc syringe with a 25 or 22 gauge needle with the bevel up at a 30 to 45 degree angle through the skin into the vein as shown here. Slowly pull back on the plunger of the syringe until the desired amount of blood is collected. This vein typically allows you to collect up to 3 cc's of blood. Once the desired amount of blood has been collected, carefully remove the needle. Release occlusion pressure at the vessel before retracting the needle. This will decrease the incidence of blood leaking into the tissues from the punctured vessels. Have your assistant place direct pressure over the venipuncture site for a few minutes. If bleeding occurs, a temporary bandage may need to be placed. If the pet is released to the owner, be sure to give the owner proper instruction on when to remove the bandage. Most bandages can be safely removed within 1 to 2 hours.